Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Semi-closed circuits. In semi-closed circuits, first we will see breathing circuits. Breathing circuits are the tubes which connect anesthesia machine outlet to the patient for the delivery of fresh gas flow. Semi-closed circuits or Mepelson circuits. Mepelson circuits include A to F, Mepelson A, Mepelson A. Here the fresh gas flow Here, Mepelson A circuit is also called as Meigel circuit. Expiratory valve is present nearer to the patient in Mepelson A. Mepelson A is circuit of choice for spontaneous ventilation where fresh gas flow is equal to the minute ventilation. Mepelson A is contraindicated for controlled ventilation. In Mepelson A, for controlled ventilation, fresh gas flow is more than 3 times the minute ventilation. Mepelson B and C are obsolete. According to Mepelson D, it is the most common semi-closed circuit used, and this Mepelson D is circuit of choice for controlled ventilation. Mepelson D is also called as Bain circuit. Controlled ventilation equals to when controlled ventilation is fresh gas flow equals to 1.6 times minute ventilation. Spontaneous ventilation equals to fresh gas flow equals 2.5 times the minute ventilation. Pediatric semi-closed circuits. In Mepelson D, the for spontaneous ventilation, fresh gas flow is equal to 2.5 times the minute ventilation, whereas fresh gas flow for controlled ventilation is 1.6 times the minute ventilation. Then we have pediatric circuits. Pediatric circuits are also semi-closed circuits. We have Mepelson E, which is Ayers-T-piece, and Mepelson F, which is Jackson and Rees modification of Ayers-T-piece. Pediatric semi-closed circuits include Mepelson E, that is Ayers-T-piece, and Mepelson F, which is Jackson and Rees modification of Ayers-T-piece. In Mepelson F, Jackson and Rees modification of Ayers-T-piece is the most common used pediatric semi-closed circuits. In this, fresh gas flow is approximately equal to Bain circuit. That is, fresh gas flow is equal to 1.6 minute ventilation for controlled ventilation, whereas fresh gas flow is equal to 2.5 times the minute ventilation for spontaneous ventilation. Mepelson F can be used in children less than 6 years and in children less than 20 kgs.
thank you and thank you for watching.